Hi everyone and welcome to chapter 6. This is your professionalism in healthcare chapter on professionalism in your professional life. So here's some of the chapter objectives. Okay, so professionalism starts with acknowledging your personal skills. Personal skills are the ability to manage aspects of your life outside of work. It is the connection between your personal life and your professional life. When your personal life or your personal affairs are in order, you can concentrate on your job and also on your career. What impact do effective personal skills have on your reputation as a professional? So working hard is very important, but there are other aspects to your persona that may be more influential in how people see you than hard work alone. Things like consistently being on time and having a positive attitude can help improve your professional image and make you a desirable employee more so than simply staying late to work extra hours without being asked if you can. So, timeliness, having a voice and knowing when to use it, asking for help. Don't let your ego get in the way. Be adaptable. These are some of the personal skills that help you at work as well. Personal image is the total impression that is created by a person, appearance, grooming, and posture. Personal habits and grammar and body and language is also a part of the personal image. It is very important in the healthcare setting that you are well groomed and you present with a clean and neat image. Patients need to have confidence in their caregivers. How would you feel if your caregiver had a ripped uniform, dirty shoes, oily hair, grimy fingernails, body odor, or bad breath? That wouldn't really look too professional. What impact could the appearance of these workers have on patients, visitors, and guests? What do you think about this picture? Well, in healthcare, we are used to typically having healthcare workers wear scrubs, right? Or lab coats, or professional dress code, basically. So somebody who's working with you and they're wearing, a hat backwards, a t-shirt, and a gold chain. It pretty much looks like it's somebody from the outside and not someone who's working in healthcare. So that's not the appearance that you want to give off to your patients. What impact does your personal image have on your patients and their families? What impact does your personal image have on you? Basically, remember the saying, when you look good, you feel good. And when you feel good, you have these vibes with you, right? So it's very important to retain that well-groomed, clean and neat personal image. Dress code. Well, a dress code are the standards for attire and appearance. They may vary from department to department depending on the duties that are involved. So in our hospital, you'll see the different departments may wear different color scrubs. For example, nurses wear that deep gray scrub color. In the laboratory, there's no set color. Our students used to just wear that green Caribbean blue color, but then we kind of evolved to like any kind of like solid color that you want to wear should be fine, but we don't use the deep gray color because that's usually in nursing. You'll see that other departments wear the burgundy color. Other departments wear blue, like the solid dark blue scrub. But our students are allowed to wear the Caribbean green, also the deep blue, black. That should be fine. Avoid colors with Avoid wearing wild colors and prints, shirts, or tops with messages unless it is approved. You don't want to have any visible undergarments. Those are never appropriate in healthcare settings. So, no visible skin on your torso, below the neckline of your shirt or top, no visible tummies, breasts, or back skin, no short shirts, short skirts, or low-rise pants, and you must maintain a clean, polished, clean and polished closed-toe shoes. Socks are usually required, and no flip-flops. Make sure your fingernails don't cause safety and infection control problems. In this picture, you can see that this person has long fingernails that are actually piercing through the gloves. So you don't want to have that. Make sure to have clean makeup, jewelry, and other accessories. Keep them to a minimum and in good taste. Some health professions actually ban jewelry. No brightly polished or artificial fingernails are allowed. Make sure that you have your hair pulled back and secure. And facial hair is allowed, but it should be groomed and neatly styled. Never wear perfume, aftershave, or scented lotion. Sometimes patients or people can be allergic to certain scents. Sit up straight, stand erect, and don't slouch. Wear your ID badge at all times as directed. Avoid non-traditional hairstyles and colors, and cover up any tattoos or remove any facial piercings. Dress appropriately on quote-unquote casual days. We are allowed to wear jeans. Certain areas are allowed to wear jeans on casual days, but the jeans, of course, have to be appropriate. They cannot be ripped all over the place. Avoid wearing blue jeans, t-shirts, or other questionable attires. Sunglasses should not be worn unless it is for medical reasons. Head coverings are limited to religious customs or job-specific regulations. The professional image is in the eye of the beholder, right? So appearance that seems inappropriate for younger coworkers might disrupt older people. Avoid attire that might make other people, especially patients and visitors, question your professionalism. So now let's talk about stereotypes. We talked a little bit about this in chapter 5. First impressions may be based on stereotypes. Stereotypes are beliefs that are mainly false about a group of people. So how might people stereotype you based on your appearance? How might you stereotype other people based on their appearance? Your habits at work impact your personal image and job performance. So as you can see in this picture, this lady is chewing gum and she's pulling it out of her mouth with her bare hands. So that's not really appropriate habits to have at the work setting. Habits can be annoying and troublesome to some people around you. No noisy shoes or jewelry should be worn. Don't pop your knuckles or bite your fingernails all the time. No jokes or childish pranks should be employed in the workplace, and don't make a mess eating or drinking in your work area. It's funny that we talked about that. We always have issues in the lounge because some people don't clean up after themselves. And so you'll see that every so often, people are complaining about the cleanup. So so if you make a mess, especially in the lounge area where you're having lunch and your coworkers will be sitting eventually, be sure to clean up after yourself. Be sure to have everything that you bring for lunch in containers where there is no spills, and that you can safely store in the refrigerator or outside of the refrigerator without making a mess. Use a hearing aid if you need it. Don't disturb others with music or loud music or radio. Don't forward chain email messages. That's a big one. Don't use business computers for personal purposes. And don't use personal cell phones or send text messages during work hours. So that's actually a little bit of a big deal for us. Our phones, nowadays our phones are always with us. We tend to put our phones in our pockets and in the lab. And so we would like you to avoid having your phone in the lab, obviously, because we want to minimize you using the phone while you're working, while you are, training in rotations. And so if you can, we would ask for you to leave it in your pocketbook, in the lockers, or in the conference room. But if you must have it with you, just be sure that the phone is in vibrate or on silent. You're not picking up your phone calls in the middle. If you have an emergency and you need to pick up or you need to make a phone call, excuse yourself, or you can do it during the break times, okay? But always be sure that you don't use your phone with your gloves. Your gloves are typically contaminated in the lab. So I would take off my gloves, wash my hands, excuse myself, and go outside of the lab to use the phone. But what we try to do is kind of limit those cell phone usages to the break times or lunch times. Don't congregate with coworkers in patient or visitor areas off shift. Most healthcare companies are smoke-free. Ours is. And so some ban the smell of smoke on employees and their clothing. Smoking at work presents an unprofessional image. Well, nowadays it's not so much about smoking, but mostly about vaping, right? So there's no vaping at work. If you must do that, follow the company policies. You can confine smoking to designated areas to protect others from secondhand smoke. Avoid taking too many smoke breaks or breaks that last for too long. And don't appear for work smelling of cigarette, cigar, or pipe smoke. Some healthcare employers require job applicants to undergo drug or nicotine screens, and if so, they won't hire smokers. Some employers charge smokers higher healthcare insurance premiums. You could obviously join a smoking cessation class or a support group by your doctor's advice. Some personal habits are also to chew gum while we work with patients. Well, you won't have that issue. We used to be very strict about gum chewing in the lab, but I think everyone is doing it. But if you must, you do it, but don't do it, very loudly. Language and grammar. So, what's totally unacceptable at work? Obscene, cursing, and vulgar language. Sexually explicit or risque comments, terms that demean members of any racial, cultural, or ethnic groups. Street language that might be acceptable for after hours with your family and friends may be inappropriate at the workplace. So I feel like this is something that I don't really need to further explain to you, and that you understand that we keep our obscene, cursing, and vulgar language to outside of work hours. If you must curse and say things like that, then you should keep it for outside of work. Use appropriate terms when referring to patients. Don't refer to people as honey, sweetie, or dear. Adult males are men, not boys or guys. Adult females are women, not girls. Don't assume an older female is a Mrs. Refer to female as Miss or Miss. Grammar is a system of word structures and arrangements. Your grammar is very important as a professional. It affects your personal and professional image. Poor grammar may indicate a lack of education and refinement. Do you need to improve your grammar? When away from work, your behavior can still affect your professional image. Your relationships, both at work and outside of work, can impact your image. The people with whom you associate with are a reflection of your personal values. We live in a small world. Your reputation goes with every place you go. If arrested and in jail, your employer may find out. If your company has a special event after hours, professional standards still apply. Be careful with social media, Facebook, Twitter, and Instagram and other social networking sites and blogs. Sharing photographs and private information, complaining and gossiping about coworkers or your employer, and commenting about patients can ruin your reputation and get you fired. Think twice about dating coworkers. Let me just go back really quick to the social media aspect. And it is really true that we need to be very cautious about what we post online, where we are every time we post something. Remember, keeping things private, especially patient information, must be private. So you don't ever put that in a public place where it can never be deleted, right? Once it's up in the internet, it'll never be gone, okay? So be very cautious about the things that you post, the things that you say, the things that you share, especially during your work hours. But after work hours, your professionalism still remains. So if you don't want to tie anything to your work environment, maybe you stay away from befriending friends or coworkers into your personal space. So that's just a little advice. Make sure that that you keep the professionalism all the way through. All right, so personal health and wellness. Workers in healthcare are, working in healthcare is physically demanding and stressful. Some people suffer from back injuries and also from exposure to infectious diseases, and those can cause problems. Ensure that your vaccinations are up to date as always, and use universal precautions to guard against infectious disease. You will be asked to undergo regular screenings and pay attention to your health and wellness while you are a student and also an employee at the hospital. To control healthcare costs, employers are encouraging employees to become healthier. Some companies offer discounts on healthcare insurance when employees meet certain health indicators. Other companies charge higher rates for employees who fail the healthcare indicators. There are health risk assessments, which are questionnaires that identify which health issues you need to focus on based on your medical history and lifestyle. And the assessment of weight and body mass index, the BMI, is also important to keep track of, right? So your body fat is the BMI is the body fat based on height and weight. Personal management skills, these are the ability to manage time, finances, stress, and also change around you. These are skills that help you keep your personal life in order and support your success at work. What might happen if healthcare workers lack effective personal management skills? Time management, and we went over this together in one of our first lecture, is the ability to organize and allocate one's time to increase productivity. Use a calendar to record your work schedule, classes, appointments, etc. Make your to-do list and also learn how to say no. That's a big factor in time management. Don't procrastinate, which is, when you postpone or delay taking action or doing something. Identify what your priorities are and seize control of your time. Make a schedule. Be realistic. Remember, there are only 24 hours in a day. What might happen if healthcare workers lack effective time management skills? Well, one of the things that can happen is that they can get really stressed out, okay? So you don't want to have that stress coming into your work life. Personal financial management is also very important. It's the ability to make sound decisions about your personal finances. We need to be financially healthy as well. We need to be financially stable in order to keep a peace of mind. So these are skills that help you pay your bills on time, avoid financial problems that could cause embarrassment at work. So in order to do this, you can develop a budget, know where your money is going, avoid late fees, pay everything on time, keep bank accounts balanced, read the fine print on loan and credit card applications, and avoid check cashing services because they charge more, payday loans, rent to own furniture, and income tax refund anticipation loans. So limit credit card use to emergencies when you have the cash to pay off the balance on time to avoid interest. Have savings plans and stick with it. Have savings to cover emergencies. Start saving now for retirement. That's very important. You might think we have a long way to go, but time goes by fast. Establish priorities for how you might want to allocate your resources and make your financial decisions accordingly. Stress management is big here, right? That's the ability to deal with stress and overcome stressful situations. Stress can make you very sick. It affects your physical, mental, and emotional health. It can affect your ability to do your job. People with type A personalities are among the most susceptible to stress-related disorders. People that have type A personalities are typically outgoing, very ambitious, and they're rigidly organized people. They tend to be a little impatient and somewhat anxious, but they are also proactive and concerned with time management. So, basically these are the type of people that we call the workaholics, right? Type B personalities are a little bit different. They're more, live at lower stress levels. They typically work steadily, but may enjoy achievement, although they have a greater tendency to disregard physical and mental stress when they do not achieve something. So they're a little bit different. So it's like known that people with type A personality tend to become a little bit more stressed. Know when stress is affecting you, identify the source, seek ways to reduce and eliminate the stress, and speak with someone who can relate to your stress and help you think through it. So it's always nice to let it all out, ask for help, speak to someone if you feel really, really stressed out. Try to keep stress from affecting your performance at work and your personal life. Balance work, recreation, and rest. Use your vacation time wisely. Learn to relax. Schedule time for your hobbies, sports, and other personal interests. Make sure to get plenty of sleep. Try to exercise and eat right. This is really what we all try to strive to, right? Use conflict resolution skills. Don't keep negative feelings bottled up inside of you. So these are some ways to manage stress. Find happiness and a positive self-image. Be patient with yourself and with others. Set high but realistic standards for yourself. Enjoy your accomplishments. Be happy with your accomplishments. What might happen if healthcare workers lack effective stress management skills, right? If you do, there's a possibility that stress can make you really sick and it can take you out of work, okay? So stress is a big, big, big factor in mental health. So find ways to relieve that stress. Stress is going to happen whether you are in school or you are an employee at the hospital. We have to know ourselves, know our personalities, and know what works best for us and how we could try to release that stress. Change is a big part of work-life balance, and we have to have the ability to manage change. Change happens. Sometimes we know it's going to happen, sometimes we don't, and we're forced to adapt to it. Managing change is the ability to adjust to change quickly, and that's very critical when working in healthcare. It's almost impossible to avoid change. We need adaptive skills. This is the ability to adjust to change. We must cope with, manage, and embrace, okay, and lead change to be successful in healthcare. Change can be a positive influence in your life if you learn to accept it and let it open new doors for you. What might happen if healthcare workers lack effective adaptive skills? Well, the inability to adapt to change could pose a problem, especially in healthcare. Just think back in all of the COVID days that we had. And when we first were hit with the COVID-19 pandemic, there were a lot of changes happening constantly in the laboratory, and laboratory professionals had to adjust immediately to the changes, okay, whether they were the patients, or we're talking about the testing, the interpreting of the results. Those were changes that we had to adapt to, and then not to mention everything else that changed during that time. But we were already in the lab, and we were able to manage through and adapt through the changes and move with those changes, okay? So in the laboratory, you must always be able to adapt to changes, whether they are at work or also in life. So adaptability is very important. And also a part of professionalism. So here are some points that you can review on your own here. But managing skills, all of that is very important in the world of professionalism and how you deal with your work and your work-life balance. Stress is a big factor, and again, I will say it over and over again, we will all go through it, whether you are in school or working, and we must find ways to relieve that stress. There is always someone that you can speak to if you feel very, very overwhelmed. And if it's not a parent, a friend, a coworker, your teacher, there are always counselors that we can reach out to here at the hospital. Please let us know if you ever get to that point, which is completely okay. We are here for you, and we want you to succeed in this program. So with that said, I'm done here. And we can move on to the case studies for professionalism.